For the Diversified Radiology Mammography team, the newest fight against breast cancer involves a new combination, 3D imaging coupled with ultrasound.
Which is the new tomosynthesis imaging, which will help us to see smaller lesions in the breast, and it also helps us to kind of problem solve and not call so many women back for their imaging. So it eliminates their emotional strain at being called back for imaging because we're able to see through the breast better.
The combination has dramatically improved the ability for fellowship-trained mammography radiologists at Diversified to see far more detail, things that might have been missed with past procedures.
Women with dense breasts, their mammograms are only about 80% sensitive. So when you combine that with screening ultrasound, you raise that to about 95% sensitivity, which really helps find those tiny lesions that even we can't see through on their mammograms.
Quicker, more accurate diagnosis and fast returns on results also helps to ease a woman's emotional stress.
That's all your hematoma. Okay. And so now it's going in the right direction. It's a mental emergency when you have these types of issues going on. I mean, they get the results the next day. They get their biopsy done that day or within a couple of days. It's not a month of waiting and worrying about the unknown.
It's part of Diversified's total team approach, partnering with each hospital for a one-stop seamless flow with the same doctors, not the anxiety and hassle of being endlessly shuffled all over town for different procedures.
The patients have all been amazed at how efficient we are at going from the screening to the diagnostic, to the biopsy, to the diagnosis.
Diversified has no competing interests. That's just one of their unique concepts, separating their practice from most others, making it more like an individualized breast center boutique rather than an impersonalized institutional procedure.
Get to know you as a person, not just as a patient. You don't feel like you're on a conveyor belt getting your screening done. You feel like you know the physician that's reading your study, and that it's the same physician that's taking care of you throughout what you're going through.
It's an industry-leading process they're using that continues to revolutionize the breast imaging landscape for the next several years to come.